Good morning, Borodar, and welcome, Croiser, to our webinar on shared lives and mental health crisis, which we hope will be informative, engaging and inspiring. We have lots of speakers to give you multiple perspectives on the work, and there will be a chance to ask questions at the end. So please use the chat function or the Q&A function. You'll see those buttons at the bottom of your screen to post your questions, and we'll pick those up at the end. My name is Benna Waits. I'm Joint Head of Psychology, Counselling and Arts Therapies for an Iron Bevan University Health Board, and I'll be chairing and presenting this morning. Now we're going to hand over to Kathryn Morgan now, who's going to talk a bit about Shared Lives Plus. So Kathryn, over to you.
Thank you, Benna. Hello, everyone. Well, that was so inspiring, and I've seen that short film clip, but that was so much better to listen to Nikita and Mags like that. So how do we make this happen in other parts of Wales and indeed the UK? So I just wanted to share the first email that I received from Dr. Michelle Funk from the Department of Mental Health and Substance Use, World Health Organization. I got a shock when I opened the email, but it spoke to all of us about a different path that people take to receive support for their mental health, and a different path for those people who are trying to use existing systems but know that there must be a better way. So we've heard today how the South East Wales Shared Lives scheme, the Mental Health Crisis Project in Gwent, is offering people that different path to recovery. It's offering them hope, a vision of a better future, opportunity, new goals, and more than anything, a loving, caring environment in a family home where they can feel safe and have a sense of belonging and feel valued. We've heard evidence from Benna today of what happens. When you build a model of regulated social care around ordinary family relationships. So as Alex said, there are now nearly 15,000 people living or visiting Shared Lives households in the UK, and the support they receive can be short-term or more long-term living. So how can we ensure that more people like Nikita and Meg that Alex spoke about are given the opportunity for recovery in their own community with that personalised, tailored support? And how can we ensure that more people are able to describe their lives by telling us in their own words that we saw on Benna's slides? So this has been life-changing for me, being given time and space to recover. I felt like I started with a clean slate and was trusted to just be me. So Shared Lives Plus is the UK membership organisation for Shared Lives carers and Shared Lives schemes like the South East scheme that we've heard from today. So we can help start those conversations, negotiations, break down barriers. We can provide evidence-based reports, those real life stories, and showcase asset and human rights-based approaches that achieve better outcomes. So from what you've heard today, if you're interested in starting a conversation, interested in partnering with a Shared Lives service and a health board, talk to us at Shared Lives Plus. We offer a range of bespoke strategic support services, which will help organisations develop or diversify shared lives in their area. We've worked with local authorities, NHS, commissioners and Shared Lives providers. I just wanted to share with you one or two slides today. So Shared Lives is growing, 42% growth over the last 5 years in Wales and 30% in England. It's consistently rated as the best quality and safest form of social care by the regulatory bodies. So we know it has significant potential to transform individuals' lives and enable society to become more connected. There are over 150 shared life schemes across the UK and 8 well-established schemes in Wales. So who are the people that we support? Alex touched on it earlier. This list has grown. People with mental ill health, care leavers, domestic abuse survivors, you'll see there. But not every scheme is able to offer such a diverse service. So how do we do this? Well, Shared Lives Plus is the expertise to support expansion of shared lives. We can provide a range of bespoke strategic support services which will help organisations develop or diversify shared lives in their area. So we can provide services like a business case. We can provide the necessary business intelligence to make an informed decision about the development, diversification and expansion of a shared life scheme in your area. An analysis of how shared lives will, with strategic priorities for adult social care and housing. So we can provide an analysis to identify the potential availability of shared lives carers in particular areas. And we can provide a multi-perspective review of existing local shared life schemes to understand people's experience of using, working in and referring to the service. You can see there communications and marketing support for any new services that are set up, and we can indeed help with the setting up of a new shared life scheme should that be needed in a particular area. So this is James and Andy, who also share their lives. And this is what a different path can look like. People who are thriving and enjoying life. At Shared Lives Plus, we'd like to see even more people sharing their lives, able to live in a place of their choice, time and space to recover and be supported to achieve their own well-being. And as it says there, from complex needs on paper to simple goals in real life. So do please get in touch with Shared Lives Plus. We're here to support the development of services like the Mental Health Crisis Project in South East Wales, and we'd love to see it in other parts of Wales and across the UK. Thank you.
That's lovely. Thank you, Kathryn.